Hi, I'm Dr. Mark Jagger. I apologize for the form of this video. I've been asked to produce it fairly quickly, so I'm doing it from my car. What I've been asked to produce is a little bit of information on the spine specialist table. I am the creator of the table. I'm the first one to use it in the clinical setting. I'm the first one to ever offer it to any of my patients, so I'm arguably put myself in the most risky area with a new product that no one's ever seen before, but I can tell you that I've never looked back for a second. Many doctors have been asking us what type of results they can expect to achieve from the business standpoint. Now, with this device, you have a unique selling proposition. You have the most unique selling proposition arguably that's ever been offered to the chiropractic, physical therapy, medicine realm in the last number of years. So you have something that no one else can compete with. That makes it very easy to bring new patients in, especially when they experience the results that this device can achieve. So what we're going to talk about is 3 different scenarios with patients. Firstly, your active patients. Your active patients, I would hazard a guess that if presented properly to these patients, approximately 50% of the patients under active care with you right now will opt to try this device. Now, looking at normally about a $3,000 package, which is quite reasonable with respect to what most other or many other doctors have been offering or asking for decompression. You can go a little higher than that, but I find where I am, my office, where it is, $3,000 is a reasonable amount that patients can pay for, and that is normally covered under their insurance policies. So looking at that, 10 of your patients that are under active care, if you can get 10 of them on augmented treatment plans from what they are, charging about $1,500 per person extra, that's $15,000 extra into your practice just with your existing patients right off the bat if you can get 10 of them. If you're seeing 100 a week, you know, that may be 50 patients that you can put on that type of scenario. Secondly, you're going to get these patients who have been under inactive care. So you've got people that show up when they're sore, or maybe people that are not always or haven't seen you in a little while, discontinued care for one reason or another, and you're going to get those people interested in your practice. Again, if you bring 10 of those people in at $3,000 for each treatment plan, that's an extra $30,000 for 10 of your inactive patients. Many of you have practices where there may be thousands of inactive patients that you can send out letters to. You need to get 10 of them to recoup $30,000. So that's a pretty amazing type thing there too, with that unique selling proposition. Even if what you were doing for them before wasn't working, you're actually going to be in a situation where now you can do something that will be working, and something that they haven't tried before, which they may be interested in coming back to see you again, because you're one of the few that offer this technology. Third scenario is you're going to have patients that have never heard of your office before that start hearing about your office because you're one of the few doctors that has this type of device. I'm actually in an interesting situation right now where I have a few family doctors that I've never met that have been writing my name on their prescription pads, writing my office phone number on their prescription pads, because they've heard from their patients and they've seen my newspaper ads, seen my internet ads. So you're going to have those 3 scenarios, and it really translates to a unique selling proposition that no other practitioner can ever compete with unless they purchase a table, same device. You're going to have even spinal decompression practitioners, and if you are a spinal decompression practitioner at the moment, the one thing that you're going to be able to change patients over to the new technology, which gets them more interested in coming for more treatment as they find out how well it's working, type of thing. So I hope that helps a little bit about what we can expect from a business standpoint. The numbers are very easy to to understand that way. You really don't have to get a lot of people that you're already treating actively into that scenario to completely transform your practice and completely transform your financial well-being. Thank you.